Well, we see the numbers every day relating to the pandemic.
The new cases, the positivity rate, and worst of all, the number of people who've lost their lives. Tonight, investigative reporter Chris Horne shows us a new set of data, the people who are driven to despair.
The rate of drug overdose is up all across our region ever since the pandemic began. Some of the reasons: social distancing, economic downturn, no real end in sight. It turns out you can die from COVID-19 without ever getting the disease.
You have your kids at home. You have your parents, everybody's on each other's nerves. Parents are going to their pills or to whatever.
The pressure from the pandemic.
People are stressed. Some way people go to relieve that stress is through their illicit drug use, and unfortunately, it's cost a lot of people their lives this year.
People who may already be struggling with addiction have lost jobs, lost touch, lost hope.
This pandemic probably does affect them a lot, and we've probably had a great uptick in overdoses because of the pandemic.
Police data show that every one of the 7 cities saw increases in total overdoses, both fatal and non-fatal, from 2019 to 2020. Among the biggest, Virginia Beach and Chesapeake. But the most alarming jumps were in Suffolk and Norfolk. During the pandemic, those 2 cities saw their rate of overdose essentially double.
Some people are losing entire families. I mean, 3 and 4 children.
Yeah.
It's insane. And there's not, I mean, it's COVID-19.
Diana Mitchell lost her daughter Brooke, a student at Bethel High in Hampton, to overdose about 4 years ago. Now she's an advocate for parents and a member of 2 grieving support groups.
We have a mom that just lost a 13-year-old. A 13-year-old.
That's what the people who counsel those in crisis are saying too.
There are a lot of young people. We're losing a lot of younger people.
Right. Charles DeLoach has been clean for nearly 30 years. He's now a peer recovery specialist for Virginia Beach. He says in the days of Zoom, it's a challenge to deliver the resources that are available to people who are already short on technology.
So if you have a clientele who doesn't have a phone, who doesn't have internet access, who doesn't, who's not adept, to using those kinds of devices, they're at a loss.
Meanwhile, the opioid overdose reversal drug Narcan is saving lives.
Oh, yes. Absolutely. Because at least you have that option to have it. I still carry it with me because I still I have contact with parents that have reached out to me. What do I do? How do I deal with it?
From looking at the numbers and looking at the repeat offenders and repeat names of victims, that Narcan has saved people and they've come back and overdosed yet again.
If you have an addict at home, it needs to be in your house.
Yeah.
It needs to be in your car. It needs to be, because you never know. Had they had Narcan when my daughter overdosed, she'd have been here today.
And Virginia's Good Samaritan law removes the risk for someone reporting an overdose.
If you call and you're overdosing, or a friend calls for you and you're overdosing, we don't charge them with possession of that narcotic, even if they have it on them with them. It's part of the law.
The pandemic will be with us for months to come, but there are resources out there, especially peer recovery specialists who can talk to you on warm lines. We've listed them on WAVY.com. Chris Horne, 10 on your side.